So we'll begin the discussion on dermatological conditions looking at blisters. So we're going to begin looking at a few conditions caused by mechanical trauma. So commonly you see blisters on the feet and the hands. They usually are they're vesicles, so they're fluid filled, and they're usually either filled with a just like a clear or serous fluid. Sometimes they may have blood in them depending upon if there's trauma underneath the skin. So some things to look at, particularly as the management's concerned, and when you look at ways to prevent blisters. And commonly what you see is if necessary, we do treat them by draining them. And the only reason being is because they can potentially tear and cause more problems. So if you're going to drain them, you have to make sure they're drained with something sterile. Cover them with a sterile dressing. A good combination is to use a zinc oxide mixed with an antibacterial medication. The zinc oxide can just kind of help toughen the skin underneath it, along with the antibacterial ointment can help prevent infection. So make sure to look at different ways to both prevent these and treat them, and include that in your on your conditions chart. And calluses, commonly see them on the plantar surface of the feet or the palms of the hands. Basically thickened areas of skin where basically there's been a lot of friction. Sometimes you can actually have situations where you have calluses that appear over top of blisters, so you can kind of get both of them occurring at the same time. Most of the time they're asymptomatic unless they get pretty large and kind of get to the point where they start to get sore. Some things you could kind of consider in regards to callus prevention, or if somebody's really having issues, is to look at how individual shoes fit them or their hand grips. Acne Mechanica, so some different causes of acne mechanica. It can be caused by pressure, excessive friction, heat can do this, and occlusion, so any combination of that. So you see this very commonly, like for instance, say like in the summertime and with football practice. Football players may get this to form underneath areas where they have to keep their padding. Not uncommon to see that. Again, that combination of pressure, heat, friction, and occlusion basically predisposes these lesions to form, and they begin as papules or pustules, depending on how they develop, and they can transition into larger lesions, so they can transition to cysts or nodules. Real simple prevention, just wearing cotton clothing, making sure you're showering immediately after practice, are all things that can help limit the formation of acne mechanica. Talon Noir is black heel. So this is something that forms, you see this a lot of times in athletes, very common in tennis players from when they're going side to side and they have to slide to a stop. Sometimes basketball players get this from shuffling their feet. Basically what happens is from the back part of the heel kind of maybe sliding around a little bit inside the foot, what it causes is some intraepidermal bleeding. So what basically it ends up looking like is you see these little small black dots that form. What that's from is bleeding underneath that layer of the skin. So you get these little black, bluish type dots that form. Sometimes they can be confused with plantar warts. So one way to kind of distinguish it between other pathologies is just, kind of gently take a either like a scalpel or even like a pumice stone, and kind of pare it away. If it disappears, then that's basically what it was. It's Talon Noir. If not, if it doesn't disappear, then you have to suspect another condition. You also, too, this could sometimes get mixed up with skin cancer as well, with melanoma. If you go to remove it and there is some bleeding, then at that point it could also be a plantar wart then as well. So now we get into some different types of skin conditions here. So we're out of the mechanical conditions. This is urticaria. Urticaria is basically hives, and this happens due to histamine getting released from mast cells. So it's a body's reaction to something. Your chapter discusses this from the concept of an environmental condition. Some people get what's called cold urticaria. So the individuals who basically get a reaction to cold, you see this sometimes in people. If they try to use ice for an injury, they end up basically developing hives underneath the ice bag or other type of cold modality. Some people can actually get this too going in reaction to heat, called cholinergic urticaria, so a rapid increase in body temperature. Even though this is basically essentially equivalent to an allergic reaction, most of the time it is just a local reaction, but they can turn into a systemic issue, so they can possibly end up basically having a systemic reaction potentially from whatever it is that's causing the urticaria to form. So we have some inflammatory skin conditions now. Contact dermatitis is a very common skin condition, and this occurs from contact with an allergen. So for instance, poison ivy would be an example of something that somebody would get contact dermatitis from. The diagnosis is usually just based upon the area and the type of lesions that form. Again, make sure that you are aware of those what lesions form with some of these different skin conditions. That's important to note as well, and understand what those lesions look like. It's hard sometimes in the diagnosis because sometimes it may not develop for up to 7 days after exposure to the allergen. So sometimes that can be difficult in trying to basically figure out. So if you notice one of your athletes and they start to develop contact dermatitis, you might want to ask them, have they changed any soaps or laundry detergents and things like that, because those are all different things that could potentially cause this. So another inflammatory skin disease is eczema, and usually this results as a result of chronic contact dermatitis. Usually what you see with this is a lot of erythema or reddening of the skin, scales and vesicles forming. This is something that again can be caused by allergic reactions, atopic dermatitis, anything that would do that. Some of the issues that come about with this, it's not contagious, but because it's very itchy and uncomfortable, it may cause the person to scratch a lot, which could lead to secondary infections. So that's something you'd have to keep an eye on because of the discomfort. So again, be mindful of the treatment points with this condition.